Good morning, guys. I hope we're all sparkly. Shout out to Jimmy the Gent and Carl with a kicking K. I can't believe we're giving shouts out. What has this channel turned into? Right, how do you tell if you're optimized on testosterone replacement therapy? With the premise being normalization of your physiology, what does that mean? Does that mean simply reversal of your negative symptoms, low mood, anxiety, depersonalization? Have you now got more energy? Are you now thinking clearly? Are you getting the gains that you put the hard work in before TRT and didn't get? Now you are seeing the reward for your effort. And we've spoken about this before, haven't we? That's incredibly important. What else? Are you able to attain a stonker? Are you having regular morning erections? Are you king dong in the bedroom? Well, all of these things are super important. Now, as you guys know, we subscribe to microdosing, daily test sip and HCG to mimic physiology. HRT, not TRT. Is it that simple? No, obviously not. You need to look at other aspects of your health. Lifestyle, reduce stress, improve sleep, reduce alcohol. Diet, eat a predominantly plant-based diet with meat and fish. Train according to your genetics and your physiology. Is that it? Is that it? Actually, no. Now, we do talk about the importance of looking after physiology to improve psychology. And we talk about hunter-gatherer. We talk about diurnal variation. Every day is a new day. Hopefully, all inspiring things for you to take with you on this journey to hormone optimization. Now, how do you really tell if you're optimized? I will tell you. It's an appreciation of the little things. That's what this is all about, actually. I was on the way to work. Guns N' Roses, Appetite for Destruction came on. I was singing loud and proud. I wanted to do a bit of air guitar, but can't do that. 10 to 2, obviously. So it's the little things. Singing in the car. Appreciating a nice sunrise, sunset. The warmth, the cold, the rain. Maddie, what are you doing? There's a squirrel. There's definitely a squirrel. You might hear some barking in a minute. But it's the ability to enjoy life. Now, we do talk about the need to be productive and active. And you do, you really, really, really do. But our consciousness wants an appreciation of the situation that we're in right now. Now, when you've got low testosterone, that's not nice. When you've got normal testosterone, it's still your decision to make positives out of negatives, opportunities out of challenges, because as we said before, risky business, opportunities drive your future. So it's the little things. That is what TRT, that's what life is all about. Having a little bit of fun, not at the expense of anybody else, because as Bill Hicks says, we are one consciousness experiencing itself subjectively. So we do need to remind ourselves to be kind. If you've visited the clinic, you will realize that we do have a very family atmosphere, and we're a bit cheeky, a bit risque. Because what is life without a little bit of danger? I'm a chauvinist pig. I'm horrible to the girls, but it's all tongue in cheek, and they love it. Wow, you love it, don't ya? Hopefully they do. Listen, they give as good as they get, because if there's one thing women can do, it's talk. So if Lydia is doing my nutting, I turn her upside down. I will always have physicality over her. So watch out, Lids. And Chuckles, Hannah, don't think you're not going to get turned upside down if you keep doing this to me. So yeah, testosterone deficiency is actually really very serious. The mental discord that can happen as a result of having low testosterone and the subsequent knock-on effect that has on your psychology can be absolutely horrendous. I've had lots of guys actually admit to me that before TRT they were suicidal. They could not see the wood for the trees. And with testosterone replacement therapy, we want you to see the wood for the trees. So whilst we joke, we make light of serious situations, it's done because men are not very good at communicating. And if we go into the neuroendocrine system, we know that testosterone and DHT are the positive male things and estrogen's the female empathy and insight. But we again need to understand the need for all of those three hormones. Estrogen for understanding empathy and insight, testosterone for drive and determination, and DHT for a little bit of aggression. It is about what? What is it all about? It's about balance, baby.